Today's guest has been a dentist for over 25 years. He's owned multiple practices. He has multiple certifications under his belt. And more importantly, wrote his first and only book called The Trooth, with 2 O's, in dentistry in the year of 2015, which focuses mainly on the patient-dentist relationship, something that has been important to doctors since day one. See, the one thing that I love most about today's guest is not only his social media presence and how he makes dentistry fun, but the way he uplifts his team around him, which creates this wonderful foundation and it boosts tons of morale within his establishments. And that's what I love most about today's guest is his drive, his passion. And it was just wonderful to sit here, talk with him for a couple hours and learn about dentistry from the back end to the front end and what makes him tick and why he even got into dentistry in the first place. So please, without further ado, welcome my guest, also my personal dentist, Dr. Ryan C. Maher. You're now listening to the Sauce Talk Podcast. What up, everybody? It's your boy Al Siggity Sauce, and welcome back to the Sauce Talk Podcast. Today, I'm here not only with my dentist, but the best dentist on this side of the Delaware Water Gap. We got Dr. Ryan C. Maher with us. What's up, baby?
Let's go. How you doing, Al? Thank you for having me. I appreciate it.
It's been a long time in the making. We were trying to schedule this, but you're such a busy guy. It's been tough to schedule, but we finally did it.
It has, and it's my pleasure. I'm glad to be here.
Absolutely. Well, look, I just want to say this. I'm not trying to blow smoke up your ass. I'm not trying to gas you up. But out of all my father's friends, all of them, and he's got many, you're 1,000% my favorite one of all of them. For many reasons.
There's no doubt. I love that statement. I know all of your father, well, most of your father's friends, and I'm pretty happy with that statement because, there's a bunch of characters there, right? But thank you. I appreciate that.
Yeah, I'm a judgmental prick, and a lot of my dad's friends get on my nerves. Some of them I love, but they get on my nerves. And you were always, when I first met you, I'm a big energy guy, and I could just tell you had such positive energy about you. Insane positive energy. You're a motivated individual. You're a hardworking individual. And, I just knew we were on the same wavelength. So that's why I always resonated with you more than most, not all, most of his other friends. So.
Yeah, I obviously we feel a connection as far as like when you are in the presence of another person, you either have that bond, that feel, or you know that they're definitely not the right person.
Yeah.
And same holds true with you, man. You're an awesome person, and
appreciate that, my brother.
We click, man.
I appreciate that. I mean, even this stage of my life, it's not that I try to keep my circles small, but I try to keep my circles valuable. And I was kind of briefly touching on that before we started. It's just that at this point in my life, man, to be around leeches or just people in general that are Debbie Downers, I'm not really into that. Like, I want to surround myself around positive-minded individuals because like I said, I'm a very emotional guy and I go off the fucking handle with my temper. So I like to surround myself around people that are positive, people that are hardworking, and people that are just successful. Not even money successful, just successful meaning they're happy in what they do or just their life in general. And I like to have that sense of motivation, that inspiration to be surrounded around it. It makes me a better person myself.
Yeah, no doubt. And the key is that you surround yourself with the right people, because there are people, no matter what you do or what, you just can't bring them out of that Debbie Downer stage that you were talking about. You're like, I love to be positive. We all go through things in life that are not that great. Everybody's got their stories or story.
Yeah.
And I got a couple of mine, but I don't feed off the negative. I feed off the positive. How is that going to make me a better person? And I try to exude that to, not only myself and my friends, but my family, more importantly.
Yeah, no, for sure. Before we start diving into your profession and what you do for a living, which I'm very, very interested in, I'd like to give the listeners and the viewers a little background on you and, where you're from, what your childhood was like growing up, things of that nature. So where did you even grow up?
Yeah, for sure. So Wayne, New Jersey, And I grew up there until 5th grade. My parents separated at that time. My father moved to Wayne. We moved to Pompton Lakes at that time. Spent a couple years there. Moved to Lincoln Park, where I did my schooling, high school in Boonton. From that point, I never saw the house again that I lived in. I was on my own from that point, pretty much. After high school, I went to college and at Fairleigh Dickinson in Teaneck, and that was it. Grew up real quick.
Wow.
Yeah. So right now, I'm currently living in Fairfield. I lived in Totowa with my wife for 4 years, and then we moved to Wayne for about 21 years, and then we just recently, within the past 2 weeks, moved to Fairfield.
Wow! Congratulations.
Yeah. Thank you.
When you were a kid, what was it like? Were you like into sports? What kind of kid were you? Were you into being a mischievous individual?
I think as a boy, as a kid, you look at kids growing up now, it's a lot different than when we grew up, right? So it's what we did, man. We built a tree fort. We were outdoors.
Yeah.
We were playing football in our backyards. We were playing stickball down the street. When the lights went off, or mom called from down the street, you ran home and you were home. It was a different type of world that we lived in back then compared to now. But I was probably the same dude that you were, just in a different town, right?
Yeah.
But did I get into a lot of trouble? No. There were things that I did that maybe weren't right, but at the same time, they weren't anything that was, creating problems for my family or those that surround me. So yeah, I was a pretty good kid, not really mischievous.
Good.
Played sports and did my thing.
What were you, like a football or baseball guy, or?
I liked baseball a lot. So football, it's a pretty good story. So when I was in Pompton Lakes, I played a couple years there, and then Lincoln Park, I went to Boonton, like I told you, and freshman year, I remember I was on the team, didn't play, but I was on the team, and I went to Clifton High School. We played them at their home field, I saw these guys coming out. They looked but 350 pounds, full beards, and I'm this 140-pound scrawny little kid, and I'm like, Coach, I know I normally don't play. I definitely don't want to play today. So that's it. So football, that was kind of the end of my career. Freshman year, I was done. I knew I was like a smaller kid. I wasn't built of stature of 350 and 6'2", but baseball was a thing, and that was it. After freshman year of high school, I didn't play sports after that. I worked.
Oh, okay.
Yeah.
You know what's funny about that? You mentioned that it's a different time now, and it totally is. I mean, I probably caught the tail end of that old fashioned, like, kids played outside a lot type of thing. Now it's like they're all stuck inside. They're on their tablets. They're on this and that. And it's tough because it's one of those things where you can't not let the kid use it because, they're going to use it in school. They're going to use it in all these things, and they have to get hip to technology and what it is and what it's becoming because it's taken over everything. But you have to deal with it in moderation because, man, you could tell the difference in the children that grew up now. And, you and I were outside a lot. It's a totally different animal. The kid they have different reaction time. They have different mentality. They have different social skills, because of you and I. We weren't afraid to get dirty. We were out running amok, and not mischievously, but, just being outside, touching the ground, touching grass, smelling what it was like, and then now these kids, they're just all over the place. They're in their house. They're just playing video games. And I played video games growing up, but I still, managed to get outside. So I try to, you're right. It's a different time. Totally. Yeah.
I'll feed off of that a little bit and say, like, I think you nailed it. Like, it's about managing the playing time on the iPad or whatever they have, some type of device, right? I know your kid, love that little kid, Max. And you guys do it right. And again, let's go back to you saying I'm not going to blow smoke up your butt, but I'm not going to do that because I know this kid. And you guys do it well. I call raising a child like Home Depot. It's a do-it-yourself project. Right? You aren't given instructions on how to do it, and then people try to tell you what to do or how to do it, but you just hope that you're doing it the right way as far as how you and your significant other feel that that's the best way to do it. And well, damn, you guys are doing a great job with that little boy.
Well, I'd like to think so, but I mean, nobody's perfect, and all you have to do is keep trying.
Yeah.
You're not going to get it 100%, but at least I'm just trying my best.
Yeah. And
not
it's fun. It's fun. It's fun going through the whole process, right?
Oh yeah,
Without a doubt. But yeah, those devices could be a little bit of a crutch for individuals like the parents, where they say, okay, this kid just needs a little quiet time with a device. Let's put him over here. But then they could just continue to lean on that crutch forever and just say, okay, just,
Yeah.
So yeah, it's tough. It's tough to manage that.
I mean, when we go out to dinner sometimes, if he's like one of those cranky moods, I'll bring it with me. Let him sit there. I can have a conversation with my wife, with my dad while we eat. Sometimes I'll bring it out. It is a crutch sometimes, and it does kind of help. But like you said, moderation.
Yeah.
Because if you're doing it too much, it's like the kid's going to be glued to it and forget
That's right.
about it.
Just manage that.
Yeah, managing. So me personally, I never liked the dentist. I don't like going to any medical practice for that matter, whether it's the doctor, the dentist, or anything. I always hated this stuff, as most kids do, especially dentists. They get a lot of they get a bad rap, and a lot of kids hate, even adults don't like the dentist. And, it's a very intimate setting. You're inside somebody's mouth, you're doing all this, somebody's in your face. So it can be uncomfortable. And my whole life until recently, after I met you, I hated the dentist and I never went. With that being said, the fact that a lot of people stray away from it and things like that, one thing that always left me curious was one's desire to actually go into the field and pursue that profession. So with that being said, what first drew you to dentistry? And was there like a defining moment or anything of that nature that, onset that passion early on for you?
Yeah, I'm going to take over the mic for quite some time here, right? So 8th grade, I remember that at that point, what was the exact defining moment? I'm not sure, but at that point, I had decided, I'm going to pursue dentistry. I spoke with my dentist at the time, and I did a shadow program, I think freshman year of high school. I actually wrote in one of my friends' yearbooks, the next time I see you, I might be a dentist. That was the 8th grade yearbook, because she was going to DePaul at the time and I was going to another high school, Booton, obviously. And fast forward, it came true, which is I'm happy. That was something that I always look back to and said, wow, 8th grade, I actually said that I want to do it, and I actually became a dentist.
Wow.
So getting back there, my dentist had said it's a profession where you don't have to worry about finding a job. You're going to be secure with that. Financially, you'll be pretty stable. Those two things drew me. Freshman year of high school, I took a finance course. They did some stock market stuff, and looked into that briefly, and they said that you have to wake up at about 4:00 in the morning to drive into the city. And I said, hell no way am I driving at 4:00 in the morning. Little did I know, now I'm waking up at 4:00 in the morning. But anyway, I couldn't do that. So I went and went back to that dentistry thought process. And then let's fast forward a little bit. And my first or second day in dental school, they said, why did you choose dentistry? And the people in the back and the side of me, they said, well, I really want to help people. I want to make their smile beautiful. And I really know that I'm going to change lives. And so it came to me, and I just said money. And the teacher looked at me, and I said, I'm half joking, but at the same time, I don't know what it's going to be like to change someone's life. I want to do that, but I have no idea. My father's not a dentist. No one in my family are dentists. I know my dentist only a little bit, but it's the security of knowing that it's a decent job. I hope that's not really my main drive after I get out of dental school, which thankfully it's not, because if you take care of people and treat them with quality care and treat them like family, the money that'll come. But I threw that out there in dental school, and they kind of looked at me a little odd, but it was in a convoluted way a little true. But you just don't know in dental school. You don't even know then in your first year, second year. After your third year, when you're in the clinic, then you could start to see the results. And that's when I really had that passion, like, wow, I really, really, really chose the right field.
Wow.
So,
well, that's beautiful that it came to you anyway.
yeah.
You didn't know at first, but let me ask you this. I'm going to segue for a moment, because something you said kind of struck with me. The fact of money and security at a young age of 8th grade, the fact that that stuck in your mind and you already had the mature sensibility to know, like, I want to set myself up. Where did that come from? Because that's very interesting. That's not a typical thing that an 8th grader would, think about.
Yeah.
That future security. You're a kid. You want to do, whatever it is and be a kid and enjoy life. But you thought about that stability, that financial stability early on.
Yeah, so I guess a little bit more emotional. I didn't know you were going to throw that one in there. So great question. It comes from my parents. They neither of them had money. They both worked their tails off, and when they separated, my mother took us in, me and my brothers, and she had to really kind of put the roof over her head. And I'm not disrespecting my father. He definitely partook in taking care of us financially, but they neither of them had money. And you could, like me at that young age, I could tell in 5th grade, 6th grade, 7th grade, leading into 8th grade that they were living paycheck to paycheck, but not even that, probably even worse than that. So like that resonated with me really, really well. And I said, I don't want this for my future. I certainly do not want it for my kids. I could see like what strain it puts on my parents at that time. And I don't want it. So that really was kind of the driving force, what the fire in my belly was all about at that time.
Wow. That's beautiful. Yeah. When you just said that now, it struck that thought in my head. Because not a typical, 8th grade boy would think of something that far into the future, that mature. You know what I mean? So that's kind of awesome. You already mentioned that after high school, you went to Fairleigh Dickinson and you graduated with a degree in biology in 3 years. Mm-hmm. And then after that, you went on to UMDNJ.
Yep.
So I got a rather unique question for you. You don't have to answer it because it might not be something that you want to answer, but it's something that I heard about and I had to ask because it was not only rather amusing to me, I thought it was kind of cool. Is it true that you paid your way through dental school by being a bookie and taking action on sports betting?
That is a great question. I'm going to answer it honestly too. It's great. How many federal agents watch this show, right? So here's the reality. I'm going to try to sum it up real quick. The answer is somewhat, maybe. Now, okay. I did not take action or book bets and have this whole entire operation. But I did have a relationship with some people that I made a couple bucks on the side doing that. But was that the source of my income for dental school? No, zero chance. No, I made a couple extra side bucks doing it. But no, I took out loans, and those are all recorded with the federal government. Yeah, thank you.
I'm sure you knew where that question came from.
Yeah, there was no DraftKings back then. There was yeah, for sure.
All right, so after you graduate, this is something that I always wondered, and it's regarding your dental school.
Yeah.
Let me throw a side thing for a second. So let's say you got cosmetologists, right, and hairstylists and stuff like that. When they go to school, it's nothing of the caliber of education that you went through. I'm just using them as an example because it has to deal with making somebody, changing their appearance in a way, whether their hair's healthy or whatever, makeup and this and that. But it's a human interaction. And, there comes a point where you could only, get the formal book study education of something. It comes to a point where, you have to do the hands-on aspect and the side of your training and your education. And, they eventually have to grab a real human person, cut their hair, or put makeup on them and do this and, have them as a guinea pig, if you will. I always wondered, for a dentist, when you're at that stage in your schooling and your education, and it's time to actually put your hands on somebody, that must have been not only one of the most nerve-wracking things, but what I also want to know is, where do they get these people? Because hair could just grow back. Your jaw and your teeth can't. So
that's great. So just so the audience knows, I had no idea what he was going to ask me in these questions. None, zero. kind of off the cuff. He said, we're going to go off the cuff. All right, great. He's talking about me being a bookie, me doing this, me. All right, so I love it because these are easier questions because when you talk the truth and speak the truth and you feel it, it just comes out. So the first patient that I had, so basically what they do in dental school, or what they did when I was in UMDNJ, which is now Rutgers Dental, they take a separate room that's not in the main clinic, and they put all like the student doctors that are going to be treating for the first or second or third time into a separate room. It's a pretty big clinic, but they know that those are the patients that are like, it's their first time. So my patient asked me, like, is this your first time doing this? I don't like to lie at all. I had to lie. Of course it's not the first time that I'm doing it. First time, first patient. I'm doing an easy filling on the patient. But anyway, so was I nervous? Yeah, man. Fear of the unknown. Like you did it on a mannequin all the time. Like it's easy. It's drill, fill, fill, do a crown, do whatever it is. It's real easy on a plastic tooth or a mannequin, right? But when you're doing it on a human, like there's a tongue involved and there's a cheek and there's saliva and there's all this other stuff that you're like, wow, I didn't really expect that to be there, right? So yeah, it's a nervous, feeling that, and I'm sure that I'd say 99%, maybe there's 1% that are like, yeah, it was okay, it was easy, but maybe they had been in the dental field for their life. One of their parents was a dentist or whatever. But for those that don't know dentistry, it was uncomfortable to say the least, right?
Yeah.
But then you get more comfortable, right? As you start to work on patients more and more, it becomes a little bit more. And that's why they put you through 2 years of working on patients. Where they get these patients is an interesting question. I went to school in Newark. Most of them came from Newark. And
really?
You get all walks. So most of them, they don't really have the means to be able to afford dentistry. And they can come from, like, what are the surrounding towns? The Oranges.
Irvington.
Yeah, sure. Irvington or even Bloomfield or Belleville, like those areas. Like there might be someone that appears to be doing well, but they're not. They just don't have the means to be able to get their teeth taken care of, whether it's just one emergency visit for an extraction or root canal, or whether they need multiple visits for fillings and crowns and other stuff. So they're from the surrounding areas, but it's most of the people that just don't have the means to be able to afford it. And that's another thing that really started making me feel good is that, you're helping these people.
Yeah. Yeah, I always wondered that because I would assume they would sign up somewhere or something for that. It's just,
Yeah,
they
call the dental school and they say, I need an appointment, and then it's a process that they go through.
Wow.
So, yeah, for sure.
Yeah, it's those back end things that you don't really get, and it's stuff that I'm a very curious guy. So I always thought about that stuff. And even though the cosmetology thing might not be the perfect example, but I just had to come up with something that would make sense as far as like human interaction and an actual person that would volunteer. But it's two different severities.
It
right?
is, but it's the same thing. It's just an analogy.
Yeah. How long after you graduated and got your degree, what was your first gig out of school, and how long was it separated from your last day at school?
Wow. Did you do research on me before you had these questions developed?
Some.
You did,
not
right?
all.
I know you did with that question. So my first gig, if you will, that it was more of like a couple days a week, was a mobile dental gig where I would travel mainly to nursing homes. And then also to people's homes, like people that they were immobile, they couldn't get out, and you would go to their home and do dentistry.
Really?
Yeah. So that's more rare, but it was more like you were doing it in nursing homes. That was one of my initial gigs or first gigs. I worked for a dentist. I won't say where, name, anything, but I worked for a dentist it's a pretty interesting story. This dentist, I looked up to him. Obviously, I worked for him. I did an exam on a patient, and the doctor, I sent the patient out. Right, they took X-rays, did the exam. The hygienist did the cleaning. Maybe a 16-year-old kid or something. I dismissed them to go to the front, schedule their next cleaning in 6 months, and the doctor came in and it said, "Where is?" I don't remember the name, Sarah, whatever the name was. Right, so. I said, she's out front, scheduling her 6 month. Well, you didn't find anything? No. Well, bring her back in here. Okay. I'm young. I'm fresh out of school, maybe a couple months.
Yeah.
Brought her back in. He says, I'll do the exam. I'm going to do the exam. I said, okay. Doing the exam. You see this? You see this? You see this? 5 cavities. Huh. Okay. He goes, go schedule them with you. I said, okay. Brought him up front. I said, you can schedule that, Sarah, with the other doctor. I walked in the back at the end of the day, which was shortly thereafter. He says, well, why is that patient in my schedule? Because I don't see the decay. There wasn't decay. You know that it was there. I said, no. I said, show it to me on the x-rays. So he said, it doesn't matter. You know it was there. I said, no, it wasn't there because I'm not going to lose my license over you saying that there's decay there. I'm done. I don't want to work here anymore. So I left. And to have the debt load that you have as a dental student coming out of dental school is significant.
Yeah.
You need a job. And back then, it's a lot easier for dentists to come out because there's these big corporations of dentistry that will hire you immediately. So it's very, very easy to get a job. It was a little bit more difficult back then. So I'm going to say, I'm going to walk. Am I going to find another job? Does this guy know anybody, et cetera? So I walked. And that was one of my first gigs. And what I say to myself was, is this what dentistry is really about? Like, is it about like unethical? Didn't we kind of sign like a little pact to say like, we're going to be ethical and we're going to take care of our patients the right way? That particular scenario, if you will, again, that developed me as a person, as a dentist to say, I'll never do that. I will never do that. And I don't want to pat myself on the back because it's never what I do. I'm humble. I'm grateful for what I have. But at the same time, I've always treated patients, and maybe that was one of the major factors, or maybe it's just who I am. Like I'm going to treat everyone like they're my family, and I'm certainly not going to do something like that to someone.
Wow.
I would not be able to sleep. Right?
Yeah.
Can you imagine?
What a crazy story, man.
Yeah. So that was one of my first gigs.
Wow. What a first gig that was.
Yeah.
And I commend you for, not letting it discourage you, because that could be a very, very discouraging situation, And what even boggles my mind even further is what kind of fucking skewed ego that guy had, that he just had to do that. For what purpose? You have somebody's life at stake, essentially, in front of you. You could fuck them up for what? For money or for ego or both?
I know it was more for money. And great, that's great. You just made yourself a mountain of money for what? Now you think you could sleep better at night? I don't think so. You got to live with yourself. You got to put your head down on your pillow every single night. And it's just, it's not like, again, there are so many professions that same exact thing. Let's take a percentage and say, let's say 5% of all professions, they're crooks, right? And let's not call this guy a crook, but just totally unethical, right? Just unethical. And that's not the way that any profession should be. So,
I think you're shooting low with that percentage too,
oh,
unfortunately.
Totally. For
unfortunately.
Sure. I
you're
know,
being forgiving.
That's really, really sad that's what we're
Yeah.
agreeing on, that's way low, that percentage.
Yeah. Well, the thing is at your core, I find you to be a very empathetic human, and I think that, especially when you're in healthcare, when you're in dentistry, you need to possess empathy to an extent. You can't be too soft, but you have to have it. You have to have a heart because you're dealing with people, especially when 90% of the people walking into your office are scared to be even in your office because they don't like that shit. Hurts, man.
Yeah.
Getting poked and this and that, it's not fun. And that's why it fears everybody. I don't know if you ever saw the horror movie, The Dentist,
in
the 90s.
Oh, yeah,
it's one of my favorites. But that definitely scarred me for a good percentage of my youth. And that's how people, even though they never saw that movie, that's what their nightmares are, consist of.
So after you seeing that movie, I can't imagine why you're afraid of dentists.
that movie shot. It's good though. I actually like it.
That was crazy.
Oh my God.
But yeah, like fear and money are the 1 and 2 reasons why people don't go to the dentist, and throw that into the equation. Forget it.
Yeah, that's a shame, man. But that's cool to hear that was your first gig.
Yeah.
Since then, I mean, it just seems like like I had a Marine on my, I'm a Marine, I'm sorry. I had a guy in the Army on my podcast, and he always had this one quote. He says, always forward. That's like his main bread and butter, always forward. And correlating that to you and your career, always forward. You're just constantly, we even talked about this prior, your drive is always there, and everything about you and who surrounds you, you elevate them along with you, and it just keeps going. So since that day, since you rejected that opportunity, you've opened many practices, many. I mean, I only know a couple. You opened the one with Dr. Richard Weiss and you in Hackensack, and I guess that was in, what, 99?
So I started working for him in 99, yeah.
Right.
And I still, I bought him out since, but I still run that practice, yeah.
Wow. 2004, Jonathan and Ryan Center for Dental Excellence in Montclair, right? Mm-hmm. Then Perfect Smiles. I mean, the list kind of goes on and on. It seems like you've had practices all over the state. So if you can, just out of curiosity for me, could you explain in depth how many practices, whether they opened or closed, I mean, whether they closed or not is irrelevant, how many practices you've opened since that day, since that rejection, if you will, what kind of practices they were, and how many were there?
So I'm gonna say the number 7. I think that's the so East Hanover, Sparta, Montclair, Nutley, Hawthorne, Totowa, Patterson. Patterson turned into Totowa. So if we can do the math on that quickly, whatever that might be. But the number's really, Hackensack, I don't know if I mentioned that, but the number's really not that important as much as it is why I did it. I think that's more the reason. I always felt like, and throughout that, I worked at the Passaic County Jail as well as their dentist.
Oh, I had that as a question.
Okay, sorry to beat you to that one. So why I did it is the main reason was I didn't really want to spend 6 days a week or 5 days a week, whatever, in the same exact place. And why? Because I'm a guy that wants to, kind of spread his wings and go to different places. The other reason is I couldn't imagine, I got a lot of energy. And on this podcast, I'm kind of calm, right? I'm not going crazy. But you know me, I got some energy, right? I couldn't imagine having a team have to be with me 6 days a week and have to deal with that kind of energy every day. They're like just turn it off for a day or whatever. So I would go to 2 or 3 or 4 different practices, how many ever I owned at the time, and just spent the day, 2 days, 3 days, whatever it was, at different practices with different teams in different offices. So that, for those 2 reasons, if you will, those were the main reasons. And I wanted to just expand.
Oh, interesting. One thing is, obviously, you're very business savvy and you're intuitive with your business decisions. How did you become that way? I mean, it doesn't just come from a class in school. Did you have any mentors regarding that aspect of your life, or?
Yeah, so that's a great question. So I'm gonna bring it back to that and something else that you mentioned before, as far as like dentistry and how they teach you. There's a couple things that they don't teach you. You said the word empathy, right? Dentistry in dental school, they do not teach you anything about empathy. They don't say that you should coddle the patient, you should do this. They teach you nothing. They say you get them numb, you drill, you fill, and you're done. Send them to the billing department, right? Oh. They don't teach you anything about business. And now, this was back when I went to dental school. I don't know if they do currently, but I see kids that are coming out of dental school, and I don't see them being business savvy. I don't want to say I taught myself, but I took courses. My brother-in-law's an accountant. He's a CPA. I asked him questions about the business end of like how to do the books. If there were any legal questions, I would go to my aunt or a lawyer. Like, if there's a medical question I don't know about, let's say cancer, whatever it is, I always go to the professional that knows best. So from the business standpoint, I would ask colleagues or people that knew those business questions that I had. How do I buy another office? Should I buy another office? How's the process work? Am I dividing my time up properly? Is this going to work for me? So I can't say that it was all me. I was the person that was willing to ask. I'm not that proud. I can ask anybody, whoever knows more than me, what the questions are or what the answers should be.
Yeah.
That's kind of how it worked.
Oh, okay.
Yeah.
That's interesting. What is Pearl success? What is that?
It's a consulting business. So I lectured for dentists from a business side of dentistry. So those who didn't really know how to build a practice, how to start a practice, how to expand to multiple practices, I would lecture on that type of dentistry. And that business was Pearl Success, the more of the lecturing, but the consulting business aspect.
Does that still exist?
It still exists, but I'm busier with. Ooh, sorry.
No, you're good.
I'm busier with my family, my kids, wife, my dental practices, more so than that. So, does it exist on a small level? Yeah.
Oh, okay.
Now, if somebody asks me, "Can you teach me how to do this?" I might not build them through Pearl Success. I might just give them the knowledge that they need.
I understand. Yep. Yeah. There are dentists who specialize, in a particular avenue of dentistry, whether it be surgical, cosmetic, pediatric, whatever. I come to realize that you don't really specialize in one. You deal with multiple avenues of dentistry. Could you elaborate further on how many things exactly that you're able to do or you're outfitted to do?
So let's talk about, rather than using me, let's talk about just a general dentist, right? A general dentist can pretty much do anything that they want, i.e. an extraction, an implant, a bone graft, a sinus lift, a filling, a root canal, a crown, a denture, bridges, periodontal treatment. They can do anything that they want, and then they can continue their education to do a little bit more in-depth surgeries or more specific type of work. When you're a specialist, like an oral surgeon, first of all, they don't want to do fillings. So they're just doing surgery all day long. When you're an orthodontist, you're not going to want to do fillings. In fact, orthodontists, do they get patients numb? They don't even have to pick up a needle. Like, how great is that? They don't have to get anybody numb, right? So they're limited to just doing orthodontics or braces or tooth movement, whereas a general dentist can do anything. What do? I pretty much do it all, right? But it's a matter of what I like to do more so than other things. Like, I won't do root canals. I could if I wanted to. I don't. I do a lot of surgery. I do a lot of implants. I do a lot of grafting and extractions and sinus lifts and all that excites me. That gets me, like really happy when I see that on my schedule for the day.
Oh yeah.
Yeah, but I also do fillings. That's like my it's a little easier, less stress, and crowns, love it. Fillings, veneers, Invisalign, cosmetics, all of it.
Which one do you like the most out of all of them?
Without a doubt, surgery, implants. Yeah.
Really?
Yeah.
What is it about doing implants that excites you the most?
There's probably not one thing, but if I had to pick the one thing, you're like, let's say an implant, you're replacing a tooth, whereas 50 years ago, 60 years ago, whatever it was, like that tooth you couldn't replace. There was no answer to be able to replace that one tooth. They would need either a denture, something removable, or they would need to destroy other teeth in order to replace that one tooth. So it's not new technology, implants. It's been around for a long time, but at the same time, you could replace one tooth and you don't have to do anything else to anything else. Just so.
Wow. Yeah, technology has increased vastly. Let me ask you this. For artists, let me put artists up for an example. I consider dentistry an art form, as I'm sure you do, obviously.
Of course.
Hearing your passion, how you're describing doing something like an implant. It's an art form in every sense of the phrase. Now, artists, they have lots of people, examples, mentors, or just people that they inspire to be. Van Gogh, Salvador Dali, Picasso, the list goes on and on with those people, Michelangelo, etc. For dentistry, I'm curious, who's your Van Gogh? And as if there anybody like that in that field that dentists as a whole look up to, that you can call them the Michael Jordan of dentistry, the Michelangelo of dentistry, and why?
Yeah, so I'll probably leave out some names only because I can't go back and say, oh, I forgot this guy, whatever it is. But like in implant dentistry, Carl Misch, John Minischetti, these are guys that are just like, they're kind of like godfathers of implants. And then there's a bunch more. But if you're just going to do implants and surgery, these are some of the guys that I would lean on, that I would say I'm going to read their books. I'm going to, go to courses that they're teaching, et cetera. But what was your initial question now? Like who's my Van Gogh? There's really not one. Like my direction is not really focused on who I want to look up to, who I want to be. It's more about what I want to be. Like my dentistry, it speaks for like every single patient. If you read my reviews, there might be 400 and something of them. I respond to every single one. And if there were a couple new ones recently, I apologize that I haven't responded to them, but I respond to every single one personally. And I respond in a way that you can read them. It says, welcome to our family. 400 and something, 500 reviews. Like wow. That's what I want. I want to be the person that people are like, you know what? All you really have to do is just treat people like family. Like that's it. So it's not really that I'm trying to say I'm going to idolize this one or that one. It's more about just me creating a culture in dentistry that I want to create, and then I want to continue. That's it.
Yeah, I was just curious because I'm not into basketball, but I could name like some of the greats. Art. I'm into art a lot, photography, things like that. You know what I mean? So I was just curious. Because I never thought about, I'm sure there's certain brain surgeons that like, if I talk to a brain surgeon, they could be like, oh, when I was coming up in medical school, this is the guy, he revolutionized this. So I was just curious, like, as far as dentistry, what were the names and stuff? That's why I asked you, but you already kind of covered some of that.
Like cosmetic dentistry, they throw the name Gordon Christensen out there. Like, there's a lot of names that people will say, how about this guy? How about that guy? And I don't want to disrespect any of them by leaving them out, but at the same time, it was really never my goal to say, oh, I idolize this guy, I don't want to be more like him. Yeah.
No, fair enough. It was just out of genuine curiosity, that's all. Because obviously I'm not going to have the type of knowledge to know who, this type of caliber of people are. Not saying that you would want to be them, but you know what I'm saying. I was just curious. So for quite a bit of time, you already hinted at it and said something before, but you worked in the Passaic County Jail. What was that fucking experience like, and how the hell did you get involved in that?
So I'll start by saying every single inmate is innocent. They would come in, Doc, listen, I didn't do it. I didn't know. I'm like, wait, what do you mean? You didn't know that the gun was on the front seat and your buddy next door was going to do a drive-by and shoot somebody? Like, come on. Like the stories that came out of that place were epic.
I'm sure.
Absolutely epic. So I'm at an event at my aunt's Christmas party, and the undersheriff, one of the undersheriffs at the time was there, and he had said to me, do you want to be the jail dentist? And there was obviously a little bit more conversation besides that. And I'm like, yeah, that'd be great. Fast forward, I became the jail dentist, and it was a good gig. It was, listen, I'm humble. I never want to look like I'm patting myself on the back or bragging, humble brag, but I risk my life every day, right? The amount of communicable diseases that went through jail are unbelievable. We'll go back to percentages. I would say 80, if not 70% of the inmates in that jail had some type of communicable disease, whether it be HIV, hepatitis, whatever it is, tuberculosis, they would have it.
Wow.
One of them. And so, if I am not careful, then maybe I receive one of those gifts, right? Wow. So that's it. I hope I answered the question there as far as,
No, you did.
In summation. But it was an interesting, good gig. I did it for 12 years and I enjoyed it while I did it, for sure.
What was the craziest case that you had there?
So when I was there, I really just did I did extractions, temporary fillings. That was the majority of the stuff. I mean, I can give you stories, not about like the dentistry was, you know, that was one thing. But I'll give you a little story. God help me, some of my patients I see this, they're gonna be like, he's crazy. They already know I'm crazy, whatever. So I had a female come in, and she's out. So they're all lined up outside, 20, 30 of them, whatever it is. And she's hooting out there, hollering out there, ooh, child. Ooh, child. And I'm like, what is going on out there? I'm taking care of this patient. I'm looking back and I'm like, I have no idea what's going on. So anyway, so she ends up coming in and sitting down in the chair, and she goes, you tell your mama I said thank you. And I'm like, ma'am, in all due respect, but you've been saying this for what? She goes, for having you. And I'm like, what do you mean? I'm thinking, yeah, like, oh, I'm going to take care of her. I'm going to take care of a toothache. I don't even think she had a toothache. She goes, I'm going to think about you when I go upstairs. I'm like, no, she didn't. No, she didn't. Yeah. Oh, yeah, she did. She did. I'm like, can I help you with something else here?
She was going to ring that Quasimodo Liberty Bell.
No doubt about it. So that was probably one of the craziest things that I ever experienced in the jail. No doubt about it. I mean, I like, if we had 7 hours, I could tell you 7 hours worth of stories. No doubt about it. But that's probably the most polished version of a good story.
You were so kind to her, she fell in love. I appreciate that. Oh my God. Let me turn down the energy for a bit. In 2012,
yeah,
you volunteered in Nicaragua.
It did,
which is crazy and noble. What made you want to do that? And what exactly? First of all, what was that experience like?
So I'll tell you how it began. And if the HIPAA police are watching this, they'll probably say I violated some HIPAA rules and regulations. But the patient, we developed a really, really, really good friendship. So I'll call him just by his first name, George. George came in as a patient, and we talked, about dentistry. And then, he told me that he was working at this college, and what he did was once a year. His family's from Nicaragua. Once a year, he would go on a medical mission. And between the two of us, I said, I would like to do something dental. He says, that would be great. So we worked it out, and I went to Nicaragua to do a dental mission and connected with a couple dentists and saw what dentistry is like in Nicaragua, versus the States. There's no sterilization techniques over there. The process is just, you go in there, you take whatever, syringe, and you change the needles. It was eye-opening as far as what the process is here versus over there. I looked out the door my first day there, and there might have been 140 people lined up outside.
Wow.
The majority being kids. And every one of them had a dental issue. Most of them were in pain. So I worked from 8 in the morning until 12 in the afternoon, nonstop, with another dentist as my assistant there. And we went to lunch. We came back, and the people that we didn't see, we saw after lunch until dinner time. That happened 3-4 days in a row. If I saw about 500 patients in that short period of time, it was very, very eye-opening. But it was It was great. It was so rewarding when you have a 9-year-old kid get an extraction done, and he's done, and you could tell that he's fearful because he wasn't feeling it. It wasn't painful, but he knows that this isn't. I don't like what's going on because they're 9, and they're done, and they go up to you and hug you. That was right there. That was everything. So to do that, I don't think I can ever duplicate it. In fact, I'm looking for another mission. I'm talking with a couple people to do something else, whether it be in the Philippines or somewhere else. But I got another story. I go home after this whole thing is done, like a week later or whatever, and I sit down with my wife, my kids. I don't know. Maybe my son was 6. My daughter was 8. And I tell them the whole story about like driving through the towns. They're like the third most poverty stricken nation in south of the equator, whatever it is. Like they're poor, right? They're very poor. So I tell them like they live 10, 12, 14 people in a basically a shed. There's dirt on the floor. They're like living with their cousins, their grandparents. It's abusive what they have to go through because they're poor, right? And I tell them about like how they eat, how they live every day. They have nothing. They're lucky to have a cloth on their back. My daughter is like wide open, following this whole story as I'm talking. She's like enamored, and I'm like, I like nailed this. Like they finally, like she's like really getting this.
Appreciative now.
She's like, wow, Dad. Like 2-3 seconds later, Tyler's like, Dad, can I have my allowance? I'm like, are you shitting me, bro? Do you hear what was going on over there? Get it one bit.
Oh my
Not
God.
one bit. Anyway. So, but that experience right there was really, really, really rewarding here.
Wow.
Yeah.
I have a friend that goes and does missions like once or twice a year. I'll talk to him. Maybe could do a collaborative effort, and he's a photographer for the mission.
Yeah.
So he takes beautiful photos. I mean, not that that's like some sort of opportunistic thing. It's just that he does that to show people like these are the missions and this is what we do here. And I haven't even like dove in deep with him, but if maybe I could link you guys up.
Yeah, for sure. I'd love to talk to him.
I forget the name of the mission that him and the other girl that I know that do it.
Yeah.
But it's very, like I said, very noble, just as noble as what you did.
Cool.
So we'll figure it out.
Yeah, it sounds good.
One thing that you accomplished that I think is incredible is you wrote your own book, The Trooth in Dentistry. I need you to sign this for me later on today, please.
I will do that, my friend.
It was published in 2015, which obviously I have right here, and I'm very happy to own a hardcover. I love hardcovers, by the way. So when I saw there was a hardcover available, I needed this thing. This book, in a nutshell, aims to improve the patient-dentist relationship and, you know, as well as education on oral health and things of that nature. How did this come to be, and what inspired you to actually write a book?
I'll reflect back to the fact that I didn't know what you were going to ask. You just said I got some questions for you. Yeah, so I'll answer that in a second, but I'm glad you brought it up because we'll reflect back to the statement that I said about when I first came out of dental school. What was my first gig? And you remember one of my first gigs was working for a guy that ultimately like treatment planned a bunch of fillings that did not need to be done. It's unethical. In my eyes, it was unethical. That was my motivation ultimately, because I saw things in dentistry for a couple of years that I just was like, I don't know, like this is not dentistry. This is not the way dentistry should be. And not that what I think is dentistry is the way it should be, but I certainly think ethics have a really, really big part in that situation. Like I always say, like if you walk into a medical office or a dental office and you see blood on the floor, you think you're in the right place? Like they're not cleaning or sterilizing the place. If you walk in there and the dentist or the doctor screaming at their team, throwing stuff around, just nasty or not, they don't have a good bedside manner towards their patients, you think you're in the right place? Yeah. Maybe not. Maybe you are. Maybe that's what you want. I'm not sure. But like that was more my motivation. It was to really educate patients to say like, it's okay to go somewhere else. But if you feel like you're in the right place, women have intuition, right? We don't have it as much as men, but they really have it. Totally. They know. Like if we had that and women had it too, like we would not be in certain situations that we're in. Like, so going into that medical space, like, just like, for example, me, I went into a doctor's appointment. I waited 52 minutes. I ultimately walked up and I said, in all due respect, I'm leaving. And I left. They're like, no, they're going to be seen next. I'm like, no, my appointment was for 52 minutes ago. Like, why should I be waiting? Like, there's no respect. Like, I don't I don't think you owe me it, but at the same time, it would be nice to receive it.
Yeah.
And that my time's kind of valuable too. Everyone's time is valuable. So it's like a whole picture of like, just know when you go somewhere, especially a medical or a dental office, that you're in the right place. So that was one thing. The other thing was like the way that, you know, your healthcare should be, right? You should focus on doing things a certain way from a dental standpoint. I have so many patients that will come in and say, "Hey doc, I thought I had an infection, so I started taking antibiotics." What? What kind of antibiotics? Oh, I just had something lying around. You all do the math on that. I'm not going to elaborate, right? It's like I had some pain, so I had my grandfather's Percocet in the bathroom, so I just took it. Like, what? What are we doing here? We're self-medicating with antibiotics.
Yeah.
So anyway, just it kind of educates you, and it's a real easy read. So I tried to make it easy to read, friendly for the patient reading it, but also more importantly, like I don't want the dentists to be kind of pissed off at me for writing a book about like if you're doing bad dentistry, like they're going to come after you or they're going to leave your practice. It's just basically like they can't come after me because if you're doing bad dentistry, stop doing bad dentistry. Stop being unethical. Stop being the person that has zero bedside manner or is mean to their team. That's all. In a nutshell.
I loved it. And it's actually sold out on Amazon. Yeah. So I had to get this at the other place. I believe Books A Million is where I got it.
Do I have to
Amazon's
talk to Jeff
gone.
Bezos? Is that what I got to do now? I got to call him up.
He just got married. He's too deep in silicone he's knee deep in it.
Exactly.
You know what I mean? No, but I love this. And one thing that I got to say, I'm disappointed. Now, I can't say I read it because I haven't yet. I wanted to, but I skimmed, and it is an easy read, which I'm thankful for because I'm not really a reader. I'm a listener.
Yeah.
I can't. I sit here, I read a line, I get, you know, I have ADHD, so I blank off. I wish this was you on the cover.
Yeah.
Not in the gatefolds, which you are, but I wish you were on the cover.
So can you imagine me? So all right, full disclosure, I wrote the content. I had a ghostwriter rewrite it for me. I suck at writing. Anybody that knows me, like English was not my strong point, and like all that whole creative writing. And all
Likewise.
that stuff. Loved math, loved biology, loved chemistry. Writing, not that great. So I wrote all of my ideas, and she ghost wrote it for me. So that's how it came out. But in the meantime, we next process was going over a cover, and so if something has to come out of what the cover is going to be all about. It's not a picture of me because I'm not the unethical dentist. I'm not the guy that's like, I'm kind of portraying, right? I'm trying to portray somebody that is like, this could be dentistry if you don't go down the right path, if you stay in the office that you're not comfortable with, if your intuition says run and you stay, right? So there was a process involved in why we picked that. And
well, that makes sense now.
Yeah.
Now that you're speaking to me, that makes total sense why you're not on the cover. At least you're on the gatefold.
Yeah, for sure.
At least you're on it. No, but I'm glad to have found it before we leave today. You got to sign it for me, please.
Will do.
It was a little tough to track down.
No doubt, brother.
But I got it. Cheers to that.
I'll talk to Jeff.
If I read correctly, you had your hand in a patent called the Children's Night Guard. Can you explain exactly what that is and when that even happened and how it happened?
Yeah, that was a process and still is a process. So I've redesigned it, and I've worked with a colleague of mine, John Nasty, Dr. John Nasty, who has been a part of this for quite some time. We've gone through 9, 10, 11, 12 years of just trying to find the right product, the design that Washington will approve. And there's always something in there that Washington says it violates this patent. It's too close to that patent. Whereas I'm going to ask you a question. I'm going to interview you for a second and say, how many children's night guards are on the market right now?
I don't even know of any, really. I mean, I
gonna
think
give
I probably, when I did my Google research, I might have seen like one or two.
I'll give you the answer.
That's it.
None. You can get an adolescent night guard, maybe, but you're not going to get anything for a 3-year-old, 4-year-old, 5-year-old.
Also, that's what you mean by children, like infant almost.
Yeah. So
Toddler night guard.
So with this podcast, there are going to be people that are like, oh yeah, my kid grinds their teeth. My kid's 5, they grind their teeth. There's nothing on the market. So why is my product being violated by some other product? The specifics of what we've designed. It will not choke a young child. They can't swallow it. It can't go down past a certain point. It stays in their mouth. It doesn't affect the eruption of permanent teeth. There's so many things that we've thought of over the many, many years. And $60, $70, $80, $90,000 later, we got nothing out of it. So I'm still
really
pursuing, but at the same time, it's not something that Washington really wants to approve for me. Maybe they knew I was a pseudo bookie back in the day. I don't know. I have no idea.
Well,
Maybe
now they
don't
know.
like me. Now you know. All right. So no, don't prove my patent. Come after me for being a bookie. Whatever you want to do. I don't care. I don't know. But yeah. So yes, that was and still is something going on.
Wow. Yeah, the patent game is it's a finicky field, and I understand from what I understand.
So the patent attorney that I was using, kind of just poured salt on the open wound, and he said, you're kind of coming out with this at a bad time. So we started a while back, but the patent process didn't start till later on. And when that happened, guess what came out? Like these Shark Tanks and all these like inventor things. And Washington was flooded with patents. So they were just deny. And the patent attorney would be like, if you send it enough times and just pay the money, they're going to eventually say, okay, this guy's for real. Well, that wasn't the case. They denied it. So we'll most likely eventually get it. It might take 5 years, 6 years, a year, 10 years, whatever, but it'll come.
Yeah, I've only seen a couple. Like I said, I did a quick Google research. I found an article on retainers versus night guards and things of that nature, and I was diving in a little bit. So what exactly, it's obviously to prevent the child or the subject in general, whether it's an adult or an adolescent teenager, to prevent them from grinding their teeth at night. Now, what is the root of grinding your teeth at night? Is it a highly anxious individual? What generally causes somebody to grind their teeth in their sleep?
So if I answer that question, you'll probably get 30,000 responses on saying why that's wrong. They won't. Most of them won't say it's right, but they'll be like, "Well, that's not right because that's wrong. That's wrong." And I'm gonna sum it up just to say, like, why we as dentists might make a night guard for an individual, and it's just to prevent enamel from hitting enamel and destroying enamel. That's pretty much the summation of it. I'll leave it at that, because if and when dentists listen to this podcast, they're going to be like, "Oh, you can't do this. It's not." There's so much more to it that we probably need another hour or two to discuss. But that, I'll keep it nice and simple. So for children, like just the simple fact of them grinding their teeth, the parents can hear it down the hallway that they're grinding their teeth, and it's just like, is this good? Is this bad? This is a problem, etc. But where does it come from? That answer is still to be determined.
Situational, I would suppose.
Could be genetics, could be, their bite is off. It could be a lot of reasons, but it's situational, it's patient-based, it's a lot of things. So it's not easy to just say this is the reason. There's multiple reasons.
Let me ask you this. Is this something that in your experience through all the years, because you're coming up on almost 30 years of being in the business, is that something that you've seen people grow out of more often than not?
Usually if you're a grinder, you're a grinder. So growing out of it is usually not the case. If you can put them into a splint or reposition their bite or change things a little bit, sometimes then you can develop a situation where they are no longer grinding, if that makes sense to you.
No, it does. Totally. That's interesting. I never even thought about that. I forgot that was a thing. I'm assuming it's common. I don't know. Maybe I know probably 20 of them. 20 people that are grinders. They just wouldn't tell me. You know what I mean? Maybe they have, those adult mouth guards or whatever that are out there. Is there anything specific that I know you, since it's patent pending or whatever the case may be, you can't speak on the specifics of the design or the mold itself. But what is it about the one that you have designed, your patent, that would, I guess you could say, differentiates yourself from the current ones that are out there on the market?
So, okay, I mean, it's not patent pending. It's just I'm trying to get a patent, right? Patent pending is you've already been approved.
Oh, yes. Yeah,
right?
it's okay. My fault. It's not even approved yet. Right, patent pending would be that you got accepted.
Yeah, I have to go through the whole process again. So, so when you see a lip bumper or lip guard on a mouth device, what do you think of? Sports guard, right?
Yes.
For football, wrestling, whatever,
yes.
Right? Have you ever seen? And you might not be going down the aisle saying, "Is there a lip guard on a night guard or whatever?" Most of them don't have a night guard, but they're relating back to saying like, "Oh, well, yours has a bumper on it." And so it's violating that patent. This has nothing to do with a sports guard. It is a children's night guard. So the fact that it's not designed differently than that, so then we redesign the lip guard. And then they're like, well, the edge of where it lines up in the teeth is a certain height that will say that that's the same height as this night guard.
Jesus Christ.
It's really, really, really specific. So anything that they could find, and again, good for them. They're trying to protect other people's patents. I respect that totally. But at the same time, when there's 0 patents on the market for children's night guards, what are we doing here? I'm just trying to save kids' teeth. But I'll go through the process and say that it's not like this, it's not like this. The problem is that the more I change it, the less it's going to benefit the kid.
And be less effective.
Yeah. So now the next route is I just make it. I don't patent it. But who's going to take over that process now? What country is going to take over that night guard now? China or somewhere outside
China,
of the US,
100%.
wherever, right? They're going to make it for, $4 when I'm going to sell it for 19, whatever it is. But like now we don't have the market on this here. And they're saying that they're the inventor and they're the mass producer of this. And then who knows what they're making it out of, right? So there's a lot to be said about having a patent, and that's really the main reason why I wanted one. But at the same time, I might have to go down a route where I don't have a patent. I got to roll dice.
Listen, one thing I will say is I love creating things. Off camera, I don't want to spend too much time on the patent, but I'd really like to pick your brain on it. And maybe I can contribute some input.
Yeah.
I just like making stuff. I like just to have an outside idea, throwing things your direction. Maybe I can lend a helping hand with. I know a lot of 3D sculptors. Maybe we can work something out. I enjoy making stuff. I'd really like to learn more about what you're doing because it interests me. It exhilarates me. Hearing this shit right now is giving me a fucking a Louisville, a dungaree Louisville. How you doing? You know what I mean?
Yeah.
But I'd like to. But no, later we'll talk. We'll talk.
All right, sounds good.
I think it'd be fun.
Yeah, it'd be great.
Yeah, it'd be good. I'm interested in that stuff.
That's good.
That stuff's a lot of fun. So I want to piggyback off of the overall message of your book. I have to comment how much I absolutely adore your social media presence within your practice and with your, I don't want to call them staff, like you said, that's an infection.
Right.
With your team.
Yeah.
I adore it. Now, are there other dentists out there that have a social media presence? Maybe. I don't know them. I know you. I witness yours. I see it. And I love it. And I love how you uplift your entire team with you. You include them in the videos, just witnessing it all. It makes the experience fun. It makes it comfortable. It drops the guard down of the patient. And it just makes you feel like you are family with your family. I absolutely adore it. treating your staff like family not only is going to benefit you, not only is it going to benefit the patients that are witnessing it, but more importantly, your team. And if your team isn't strong, your team is a crutch. It's just like a leg of a table. You take one leg of that table out, nothing. The stronger the legs, which is your team, the stronger your business as a whole, the stronger the morale that is boosted within Perfect Smiles. And it's, I really tip, I don't wear hats because of my hair, but I tip my hat to you, man, because you create an environment, you created a zone where everybody is just on this pedestal equal with you, even though they're not the dentist. And that is the most noble, important thing. And I bow to you and I tip my hat to you. And what was the inspiration behind creating an environment like that? I know you spoke on it a little bit, but to have that social media presence, I know there was something that happened within you that sparked it.
I mean, I could just do a mic drop right now and just be like, you nailed it. Right? I could be like, I'm done. What he said, right? So thank you. I appreciate that. It's a pretty easy question for me to answer. I'm going to first say that there are dentists out there that are killing it, destroying it on social media. Their number of followers, what they do, et cetera, that's great. But why, right? Why did I do what I did, and why do I do the way that I do it, right? Yeah. So I have to start by saying I give Wendy big props. She's my social media girl, and if I failed to mention her, I would be definitely violating some happy times with her. So I definitely give her big props. But in the meantime, like, my main goal was this. I'm a normal human being. I'm a family guy. I'm a person, right? I'm a human. I'm on the same exact level as my entire team. I'm no better. I'm no worse. We're all the same. They all know that, right? As far as when I do dentistry, this is super important for people to know. So that when they come in there, when I do dentistry, I'm locked in. I'm type A. I don't fool around like I do in social media. I do dentistry and I do it really well. And maybe I will pat myself on the back because I know I'm proud of what I produce as far as cosmetically, as far as like if I take a tooth out, the lack of pain that they go through during and after, the lack of every single procedure that I do, any exam that I do, whether it be for oral cancer screening or fillings, et cetera, every single step of dentistry that I do it with passion. I do it with the fact that I'm a professional and I'm locked in. Coming to social media, I want them to know that my office and myself, we're normal human beings. This is how we behave. We're like, yeah. You have to feel comfortable knowing that I'm a person. When they see that the dentist is not just this scientist wearing glasses, the nerd with a lab coat. It's not us. Like, when you come in there, you'll feel, you said it at the beginning, you walk in there, you feel like this is a good environment. The culture that we've created, it wasn't just me, we all created it there. The culture that we created was just that, what you explained earlier. And that's what I want the social media presence to understand, is that we, and myself certainly, are just normal people. But at the same time, I want them to understand, because that doesn't maybe get explained as much or presented as much, that I'm locked in when I do dentistry. So
it's beautiful.
Does that make sense?
Oh,
yeah.
Makes perfect sense. Like I said, even when I walk in, the two beautiful ladies at the front desk, they're gemstones. They're nice, they're quick, they're efficient. Phones ringing, they're picking. Listen, like I told you, I'm a very observant individual. I observe things when I don't need to observe things. I'm always aware of my surroundings, who's behind me, who's in front, what the trim looks like on a wall. This is just who I am. It's not even like it creates effort within me. It's just who I am. I'm very observant. I'm seeing how they're answering the phone, seeing how you got a good staff, my boy. Like, you really do. Really good guy. The Dominican other guy, he's great. I forget all their names.
Good team.
Good team,
yeah.
Solid team. They all look happy. Even the interns, when they come in and I see a new face and I know they're in dental school, or I know they're doing whatever they're doing, and they're there, they're nice, they're happy, they're whatever, they're learning. It's a great environment. And like I said, I don't like dentistry. I never did, as far as going there, having appointments. I don't mind coming to your establishment, and that should speak volumes coming from a person who fucking hates having somebody in my mouth when I don't want them to be.
So can I just feed off of that a little bit? You know, I have a talk personally with every single intern, extern, student doctor, someone who's shadowing, future employee, every single person that comes into the organization of Perfect Smiles. I have a talk with them one-on-one.
Okay.
And I say, one of the main things I say is like, this is life or death. And they're like, what do you mean? Because if you're reckless in this office and you leave a needle uncapped, or if you put a needle in the garbage can and not the sharps container, and somebody goes to compress that garbage can with their hand or their foot and they get spiked with that needle, could cause them death potentially, right?
Yeah.
Right? Just be cautious. If you're working on a patient, drills, high-speed instruments, et cetera, everything that we do is kind of life or death. So just be cautious and cognizant of that fact. That's one. Number two, if you're not 15 minutes early, you're late. Number three, there's certain speeds of dentistry that it's red light, green light, orange light. What do you do at a red light, Al?
Stop.
What do you do at a green light?
You go.
What do you do at an orange light or an amber light?
Slow down, baby.
What do? I step on the fucking gas as fast as I can. I go through that light, right? Those are my speeds of dentistry, right? You either go slow, you stop, like everything's done, go on your phone, go on social. I don't care what you do. Enjoy yourself. Go out for a cup of coffee. Or there's 4 patients in the waiting room, 3 patients in the chair, 2 patients here, emergency coming in, phones are ringing. Step it up. But always be cautious, right? And then I said, the last thing is your attitude.
Yeah. Huge.
If you're gonna decide that you don't want to show up one day, or you're gonna come in late, you're not gonna be welcome here, because we all behave the same exact way. If you're gonna be angry and not appreciate your staff and your team, I apologize, I use the word staff, and you appreciate your team members and your family here, you're not welcome here. So 27 years of doing this, like, I'm blessed to have that team. We've all built it together, myself and everyone else, because they'll also do an interview process in their minds. And I asked them all, I said, is that person the right person? Is that one the right person? And some people we don't allow on our team. But that's the behind the scenes type of thing that goes on there. Yeah.
Of course.
Yep.
No, but it's a solid environment, solid team. And like I said, I pay attention when I don't need to, but I just can't help it. It's in my nature. I pay attention to the little idiosyncrasies that go on around me. I can't help it. Speaking on that.
I think that's great, by the way.
Yeah? You think it's great?
I think it is.
Can't help it. One of the things I noticed when I go see you is I just look around the room. It's one of my main things that I do. And, I noticed you got Belmont equipment, Belmont chairs and stuff. I know they're known for making high quality crafted upholstery, especially for barbers. I know Takara Belmont is the same thing. They make dental equipment. They make that. Was that a personal choice for you, or was that just something you chose on a whim? Let me just get a lot of dentists use Belmont. Let me use it. I'm just curious, because my barber uses a Belmont chair. The leather is fantastic. It's comfortable. My back feels great in it. Belmont makes legit stuff, all handmade. I love Takara Belmont. And when I saw the insignia, I was like, my boy. So I was just curious about your experience with Belmont and just dentistry products and upholstery as a whole.
I mean, I have to have a meeting with my staff and my team, like to go over, like, people are actually seeing the name of our chairs and everything else, that they're recognizing stuff, and God bless you.
You're not going to get many people like me, I'm telling you right now.
No, but like, I love it, because I'm observant, maybe not as observant. I don't go into my medical doctor's office and say, does he have a Belmont chair? What type of chair? But that's on another level. So I can speak of that for sure. So we have a dental convention once a year in November, right after Thanksgiving, that weekend, in Jacob Javits. And they will present all the latest and greatest chairs and products and composites and everything known to dentistry. They're gonna present it there. And we walk the aisles and talk to people and whatever. So we as dentists know certain dental chairs, what's better, what's worse. And then you look at it from a financial standpoint. When I bought those chairs, they were on the higher end. There are still chairs that are even more money than that. But But when you have a product that you know that you can get serviced, the parts are there readily available. The technicians all love it. Like, it doesn't matter what you do, and it's a workhorse. You know that it's a great product and it's going to last a long time. I said, all right, give me that one. Now, am I in the middle of the road or lower of the road? No, I was at the upper end, but I just said, you know what? If I buy this product, it's going to last longer. People are going to be able to service it, et cetera. And in all due respect, I bought other chairs. I've had 7 dental practices that I bought or sold. And there were other chairs in the offices that I bought. So I've seen the cheaper products, they're garbage. They're garbage. And I'm not saying that all my products are Belmont, because there are other products that are comparable. But at the same time, like the cheaper stuff that you buy, you get what you pay for, right? Yeah. So there was some calculated decisions that I made with Belmont.
I like Belmont. Like I told you, like my barber's got a Belmont. Love, you could pick the trim, customize it to whatever color scheme you want. Their customer service is exceptional. The servicing's exceptional. That's why when I saw, I was like, oh, that's a Belmont. Like I know. That's why I did my research. I had no idea that Belmont made, dental or medical upholstery. So that's why it was cool.
Dental chairs.
Yeah.
The whole chair, the delivery system,
the plastic, everything, right?
Everything, the whole entire unit, Belmont. Yeah. They're big in the market.
Wow. No, I had to ask just because I enjoy that. Speaking on that, I don't know anything about dental equipment and dental brands as far as the tools and utensils that are. Is there a particular brand that you flock to when it comes to any sort of dental tooling? As far as the specific stuff, the drills, the stuff like that. Is there a particular brand that you like to stay in house with, and why?
So you're asking a pretty broad question. So if there's a hygiene instrument that cleans the teeth, the hygienist use instruments to clean patients' teeth, right? I will go to the hygienist to ask them what they like best, because they're the professional.
They're the ones using it. Makes sense.
They're right. That's their space, and they'll usually go to a Hugh Freedy. Like that's one of the better, or
Hugh
one
Freedy?
Of the best. Hugh Freedy, HU.
Okay.
Freedy. That's one of the best in the industry. But if we talk about a dental drill, it depends if we're talking electric or air-driven, electric NSKs. Like there are certain products that just are better because why? Because when they cut tooth structure, they don't vibrate. When you get any type of vibration or excessive vibration, you could cause an irritation or damage to the nerve. Something that delivers water when you're drilling at a certain percentage, if you will, where you're cooling the tooth when you drill. Because if you're not cooling it enough, you're burning the tooth, creating necrosis, or you're killing the nerve. So that tooth is going to need root canal maybe down the road. So yeah, there's a process involved in why we select the equipment that we do. But I'm not going to say that, like, if I have my NSK that I love, electric handpiece versus somebody else's electric handpiece, that it's mine superior. I'm just saying that mine is electric, and that's the reason why I do it. And I use the certain drill bits or the burrs that I use to drill the tooth. They're of certain quality as well, so that I can produce the most successful filling, crown, or whatever type of dentistry that I'm doing, so that the patient has less pain, zero pain post-operatively, and no ill effects down the road, like, oh, now the tooth needs root canal.
No, listen, I want to dive deeper in this. I like this stuff.
Yeah.
Let's go in a little bit. So now, when it comes to drilling and stuff like that, I assume that at a certain point, either A, you have to replace the bit or get them, I don't know, is there a type of sharpening? Do people come out and sharpen? You just completely replace it?
So with the hygiene instruments, you can sharpen them. With the drill bit, you use it and you throw it out. There are some that are multiple use, and then some that are single use. So it depends. That's a whole nother conversation. But let's just say if you have a single use drill bit, you use it and it's disposed of. If it's multiple use, like a diamond, then you can autoclave it and then you can reuse it. But
interesting. Do you have somebody that comes out to sharpen your tools, or do you do it yourself in house?
So we will send them out to a professional company when and if. Otherwise, we'll just get new instruments.
Interesting.
Most of the times, we'll have either the hygienist, if they've sharpened them a little tiny bit, fine. If we send them out, we're scratching our heads. Why don't we just buy new equipment? Right. So if you look at my profit and loss and look at dental repairs or your sharpening of instruments over the last 20 something years, you're going to see maybe we've utilized the company 4 or 5 times.
Oh, so it's not even worth it. You might as well just buy new.
Right.
This way you're getting precision and all that.
And I'll also say that those who do sharpen the instruments, it's great. That's not a bad thing. It's actually a really good thing. You keep your instrument sharp. You could do it chair side, like, the hygienist could do it, or you could send them out. That's, I think, a better way to do it. But regardless, we'll usually just buy new instruments.
Okay. That's cool. I was just curious because I like I said, I get interested in stuff like that. And when it comes to barber instruments, a lot of them are using Japanese shears, certain types of metals, titanium, stuff like that. Obviously with a shear, you're going to get them sharpened. You're not going to, it's different. Your tools are more like fine and thinner and smaller. So I would assume that you could only sharpen them to a certain extent anyway. You're going to take off too much of the actual utility itself.
Exactly.
So that's cool. You talking about the air drill
versus the electric.
Yeah, that's
right.
Very interesting. I never even thought that there was the two.
Yeah, like it's night and day when you have, and again, there are certain air-driven drills, handpieces that are smooth. Most of them are, but then there are certain ones that are just like.
So what's the instance that you personally prefer to use the air as opposed to electric?
No, electric versus air.
So you never use air?
I do use air. Because remember, I've had multiple offices. So if there's air-driven instruments there, high-speed handpieces, I'll use them, but I'll make sure that the handpiece that we use for the high-speed air-driven handpiece is of good quality, really good quality. Because the cheaper that you get, and let's say the lower RPMs that spin at, or the more vibration that it causes, the more discomfort you're going to cause, the more pain, the more problems you're going to cause to that tooth, short or long term. Yeah.
I never even thought about that there would be a discrepancy with vibration
between
the two.
The delivery of the water too. That's even more important sometimes.
Well, I guess that would go down to PSI and stuff like that.
Yeah, but so let's just say you have a not so good handpiece that's delivering a ton of water versus a little bit of a better handpiece that's delivering a little bit of water. The not so good handpiece that's delivering a lot of water is going to be better because it's delivering the water. The water is more the factor there versus the other.
Wow.
Yeah. So there's a lot involved in that equation. So
I know we could dive deeper.
We could dive real deep. Yeah. We're going off.
We'll do it in private. So that stuff for real. That's the shit. That's my bread and butter.
Yeah.
I love to learn that stuff. Are there any misconceptions about dentistry that you often find yourself correcting and addressing often?
So have you ever seen a dentist stand up and kneel on a patient's chest to get a tooth taken out? Because I never did.
Never. That happens?
None of my colleagues, this is kind of half joking because you're like, are there any misconceptions? I've never seen it, never heard of it ever. It's like George Washington having wooden teeth.
I've heard that.
Right?
I've heard that plenty.
Right? They were ivory and they were made of other things besides not wood. Yeah, right. So yeah, no dentist has ever got up on a chair and leaned on someone's chest to take a tooth out. That's like a misconception. I know that's not what you were getting at, but I just had to point that out. I had to point that out. Other misconceptions as far as dentistry is concerned? I don't know. Give me an example.
I don't know. I was just curious. Like if there's anything you heard in the field or online,
root canal is a very, very controversial issue. Like, so there are, I don't know, TikTok, Instagrams that say that root canals are bad and they cause this and they leave an infection in here. And so I'll believe that to an extent, believe it or not, but I'll also dismiss it because if the root canal is done perfect and it's filled perfectly, then that's not going to happen. Like infection's not going to lie there and it's not going to create problems long term. But if the root canal is not done properly, yeah, that stuff that they're talking about online on the social media sites could potentially happen.
That's the danger of social media, is how highly influential it is on the masses. Because, if you're a person and you're just Googling something, you'll see something that pops up like, damn, you'll believe it instantly just because it's instinctual, and it could really cause some damage. That's why it's really important in this day and age to do your due diligence and not just take the first thing you read. Sit there and really do your research. Sit there and really read through things, hear testimonials, and, do your review, especially when it comes to somebody like you that has a lot of positive reviews out there. Read the reviews. Make sure you know who you're dealing with before you deal with them. It's very important.
Yeah, exactly. I mean, you said it. You summed it up. Do your due diligence, right? That's it.
Totally. Since you started your career, right, until now, how much has the dental industry changed as a whole, specifically with technology? And which technology has really helped make your job easier in its current state from when you started up until now?
The last question I'll answer quickly is like, which technology has changed my life in dentistry? A 3D CBCT scan, which is a cone beam scan, which basically will allow us to take an x-ray of the entire jaw for the most part and make a three-dimensional image of that person, versus when you take just a regular x-ray, it's a two-dimensional image. You see the height, the width. You can't see the width, the height and length. But that 3D scan you can map out exactly where the artery is, where the nerve is, where all the structures that are really important that you want to avoid hitting as a dentist, because that can create pretty much a lawsuit. But also the amount and quality of the bone that's present, so that if you have to do an implant, you can do it successfully. And you don't really have as much of a nervous feeling when you're placing it, versus the old x-rays. You're like, am I too close? Is this a problem, etc. That CBCT 3D image has definitely changed my life in dentistry. Like, I don't have much fear. And when there's not enough bone, or when it's too close to, I know to step away and say, this is not my space, refer it out, or don't do it.
Oh, interesting.
Yeah.
Wow, that's bonkers.
How much has that evolved? Look at the internet. Look at everything that's going on around us, AI, etc. It's probably not evolving as quickly, but it's at a pace that's really, really rapid. And it's fun. Like, they have AI in dentistry. Like, I look at AI and I'm like, I've tried to get involved in some type of AI in dentistry, and it's not really that prominent just yet. It will be. But AI in medical, so if a doctor's doing a surgery, whatever the procedure, and they have AI, and AI has said 95% of the times that the doctor does the procedure like this, it fails, or the patient dies, or whatever happens. So AI now, you have gear on it, says, doctor, don't do it that way. Go down to the left side, not to the right side, because if you do it that way, your chances of success are 5%.
Wow.
Right? So AI could be a really, really good tool. AI is like, that's progression.
Totally.
We all know that it's a bad thing, could be a really, really bad thing in our world or our space as well. But in that type of situation, it's a really good thing. How about me placing the implant myself, or a robot placing it? There's robots now in dentistry that are doing dental implants.
Are you fucking serious?
No, that's for real. You get a machine, a robot that comes in and does the dental implant for the doctor.
Which could be a good thing, but I would presume it's a bad thing, because then there goes your gig.
So, I mean, we've been we've been talking about this for a long time. This is going to replace that. That's going to replace that. But what happens when that gets replaced? Something else develops. Somebody's got to watch the robot. Somebody's got to fix the machine. There's always another job to replace it, I would say. So I don't think it's necessarily a bad thing. I look at more like the accuracy of how the robot can place it, especially when you have a CT scan married up with an image, married up with a stent that they can place it exactly, and it's going to be so precise. Like, we might have a shake to us. We might have a nervous feel to us. We might have had too much coffee that morning. Whatever the case is, like, that robot didn't have any coffee.
It does
Does that
exactly
machine-
what you program it to do. So
Right.
you're not opposed to it totally.
I'm not, no doubt. I mean, and we're watching the robot do it. If we see that robot's drilling too deep, stop. So it's progressed significantly is the answer basically.
Wow. How has 3D printing rather affected the dental industry?
I really can't speak too much on it because I don't have 3D printing in my office particularly, but my lab tech, my buddy John Campoli at Pro Labs,
What a name.
He's genius. He is genius with 3D printing. He's a mastermind. And you talked about Van Gogh and all those artists. He is one of them guys. So
Did you say in your lab?
No. This is my
The lab that you use?
good friend. He's a lab tech. Anyway, so he's really like if he was here, he could speak on 3D printing for hours. But I will tell you that I can't really speak of it too much. But when he generates something that's 3D printed, basically, like if I'm doing a full upper case, like all the teeth on the upper, I placed 5 implants, and we're going to put a prosthetic crowns or a bridge over those implants. He'll print something that says this is exactly what we're going to have. Now, the old days, we would get the final product and we'd be like, well, it's slanted, or the teeth are too big, or the bite is off, or whatever, right? It doesn't feel good.
Yeah.
We print something, we put it in there, we say to the patient, how's it feel? What's it look like? Everything's perfect. The bite's off, we adjust it right on that printed model. We take pictures, we send it back to the lab, they finish it the way, like it's spectacular. So I love it, but I just can't speak of it because I don't 3D print in my office.
Oh, gotcha.
Yeah.
Has that ever been a thought that you want to do that in-house?
So I would say talk to me in 2 or 3 or 4 years, outside chance, but no, 0 chance right now. Like I'm not a lab tech, I'm a dentist.
Yeah.
I
get you.
want to prepare teeth. I want to work on teeth all day. I don't want to work on a model that I'm printing from a machine. I want my lab tech because they're the best at that.
Totally.
Yeah.
No, I get you.
And there are dentists that do it, and they do very well, and they're good at what they do. But that's not me.
Yeah. No, I get you. After all this time in dentistry, for you, you're over 25 years. Retrospectively, thinking back on your career up until, present day, what do you love at this point most about dentistry?
Wow, that's a great question. This probably is going to come out like you're going to be like, really? That's what it is? It's really more about, obviously, the patients, they've built our practice. They're the ones paying our salaries, right? Ultimately. But it's more about the family of individuals that surround me every single day in and day out, my team. I really love that in dentistry. I love going into work and being with them and doing what we do together versus we know we could produce a great crown or a great filling, or like some kid broke their front tooth and we can reproduce this exact match of what we know that we could do that. But when we are going into our workspace in the morning and everybody's fired up and motivated to be there and to spend the whole day, and at the end of the day they're still just happy and they're not miserable being there. I think that's more my why. Versus like 25 years of I love to make people smile. We do that every day in and day out. But it's more about having created the team.
Well, that's beautiful.
Yeah.
Truthfully. What do you hope your legacy will be as a dentist? And if you could change one thing about the dental industry, what would it be?
Well, to tell Tyler and Alexa they should have been a fucking dentist.
Would you really want them to be dentists?
No. Jen and I, from a very, very, very young age for the kids, when they were young, we said, you do what you guys want to do. It doesn't matter. And we hold that.
Yeah.
Like whatever, it doesn't matter, right? Like just go to work and be happy with what you're doing.
That's important.
That whole phrase of love what you do and you'll never work a day in your life. Like that,
totally.
that holds some truth, right? So yeah, they're not going to become dentists. But at the same time, repeat the question for me so that I can go back and not be joking about it.
No, I was just saying.
Like my legacy?
Yeah. What do you hope your legacy will be as a dentist? And if you could change one thing about the dental industry as a whole, positively, what would it be that you would change?
I mean, this is more of a current time situation. I don't really look to have a legacy, right? I don't think anyone that unless you're building a family legacy, I don't think anybody's looking like, oh, I'm an owner of a sandwich shop and I'm going to build a legacy for it, or doesn't matter, Jersey Mike's or whatever, anything. I'm not looking really as far as the legacy standpoint as I just want to do the right thing, right? And I'm not. People know me for 27 years of dentistry. I'm not trying to say, oh, this is me or whatever. They see it. Actions speak a lot louder than words, and this is what I do every day, day in and day out. What would I change about dentistry? The workforce has changed significantly. If I could just grab some of the people that are, and they're not my employees, but some of the people that are out there and shake them a little bit and say, what the fuck are you thinking? Show up to work, love what you do, work hard, enjoy what you like. If you don't like it, do something else. And but that holds true for a lot of fields nowadays. And I don't want to piss on the newer generation and gen this, gen that, gen whatever. It's just that the work passion, the work ethics, the I don't know. It's just changed a little bit. Yeah. And dentistry is no different. I would love to change it because it's a rewarding profession. We want to keep it that way. That's all.
Good. Well, listen, Doc, thank you so much for coming. I learned so much about dentistry today. I owe it all to you. You're the best. I'm happy to highlight your career. What else is next for you? Do you have any future plans? I know before we started recording, you told me you brought on some new consulting firms. So is there anything you want to share with the public on what's going to be the future of Perfect Smiles LLC or no?
Yeah, so I've always looked at, so we talked about business, right? The business of dentistry. They don't teach you that in dental school. And I, like all dentists, we kind of have to learn it ourselves. So I don't think that any business would do well if they stayed at the same exact level financially, the same, income, or if they went down. And I've always evaluated my business in that same way. So you always want it to kind of go up. You don't need it to ramp up, but it always has to go up just a little bit incrementally every year. So yeah, I hired a consulting agency, not because I'm doing something wrong or my team is, but just to keep us in check. Are we doing something that could be done better for our patients? Are we doing something, that's not the newer technology or not the way that things are progressing towards dentistry? That's the reason why I, have entertained and hired a consulting agency. What's the future for me or for Perfect Smiles? It's that. It's just to keep on growing and, at a slow pace. It doesn't have to be overnight, ramp it up. It's just like everything that I've done has been more on a slower pace. And I love when I look back to see what I've done. And I know that I'm not going to change it. I'm just going to continue it because it was successful before. And that's what I'm looking for in the future.
Amazing.
That's it.
Beautiful.
Thank you.
Thank you. I'm so happy to finally get you in the seat.
Yeah.
It's been a while.
Thank you for having me.
You're a gemstone.
I appreciate you.
An absolute gem. Perfect Smiles LLC. Go get your fucking teeth checked. Thank you so much. I love you, brother.
I love you too, bro. Thank you.
I mean that in every sense of the word. I love you.
Thank you, bro. I appreciate you. That means a lot.
Thanks again, man.